Hi everyone, I'm Colleen Pearson. I am from Garfunkel Wild Investigations, Audits, and Regulatory Compliance Practice Group, and I specialize in long-term care. I joined Garfunkel in October from a private firm in the Albany area, and before that I worked for about 12 years in state government, doing all facets of government work, including working for the governor's Division of Budget. And I'm happy to be here with you today to talk about this topic that has become an issue for most people in the adult care realm. And so hopefully this presentation will help you in your applications for medical equipment waivers. So to start, why are we doing this webinar? The New York State Department of Health revised its submission process so that the process is more efficient for both providers and the Department of Health. As a lot of you know, when you're submitting your waiver requests, they are taking a very long time to get approved, and it leaves you in limbo. And so this process is supposed to make everything more efficient, but also it's very important that you know what to put in your application so that they don't get held up in review by the Department of Health. So I will go through what you need to include in your requests, and we can go from there. So this new process was implemented to streamline the medical equipment waiver review process and minimize the time needed to successfully submit and process requests. Medical equipment waiver requests, unlike in the past, are to be resident-specific, not facility-wide, so that is something to keep in mind as we go through this process. As an initial matter, we will be sending around a copy of this presentation, and at the end of the presentation, I will be answering questions that you may have. If you have questions that pop up during the webinar, feel free to put them in the Q&A, and I will address them at the end. So waivers and equivalencies, they both, you submit requests for both using the same form, but there is a big difference between the two. Waivers are New York State regulations allow waivers for non-statutory requirements upon the request of an operator. The most common waiver sought by operators is the medical equipment waiver. Equivalencies, on the other hand, allow operators to adopt an alternative method of compliance with the regulation. They still require a submission to the Department of Health, but it's more or less a notification to the department that you are taking advantage of one of their approved equivalencies as a means of complying with the regulation. It's not so much you submitting a request and receiving approval back from the department, because the department, in publishing their index of equivalencies, has already approved those methods, whereas a waiver request, you are asking approval because there is no set list of approved waivers at this time from the department. So medical equipment waivers, as I said, that is going to be the focus of today's webinar because that is the most commonly requested waiver, and the process has changed. So while the process changed in about 2022, we're going over this now because the department is still seeing applications for waivers held up due to small errors on applications. And so today I will walk you through the things you need to submit and things to keep in mind so that your application does not get held up. So who can submit a waiver? Adult homes, enriched housing providers, and residences for adults can submit waiver requests. If you have a facility with a higher level of care, you have an ALR, you have an ALP, you can still submit medical equipment waivers for your residents. However, because the residents require a higher level of care, you will require special consideration by the Department of Health for that request. And while the department always has permission to request additional information from you for any waiver request you submit, they will be looking for additional information to be submitted with your waiver requests for these ALP and ALR residents, because They need to know that the resident has the capacity to understand the need for the equipment and use of the equipment. The department wants to know how much assistance will be needed from staff at your facility to help the resident use the equipment, and also how you will be training staff on the equipment, and training them on how they can assist the resident. So it's important to keep that in mind. You can still submit a request, but you're going to need to submit some additional information to make the department feel comfortable that this resident who does require a higher level of care still can use the equipment with the assistance of staff. So when do you need a medical equipment waiver? Medical equipment waivers are absolutely required for hospital beds, high-low beds, height adjustable beds, half side rails, enabling devices, and trapeze devices. So if you are looking to get any of these pieces of equipment for your residents, you will need to submit a waiver request. You do not need to submit a waiver request for non-hospital beds, such as Tempur-Pedic beds. However, while you don't need to submit a waiver request, you still will need to submit an equivalency. Again, that's the notification to the department using the same 4235 form, notifying the department that you are going to be utilizing one of their approved equivalencies. Items that don't require either are things like oxygen concentrators or orthopedic shoes with braces. However, keep in mind that certain documentation must be kept on file at the facility, even though you don't need the waiver or the equivalency. Later on in the presentation, I will be talking about the record-keeping requirements that you have to comply with per the Department of Health. So the waiver submission process is the big change here. And so while you used to submit medical equipment waivers through your regional office, that will no longer be the case. Waivers will be submitted through a Drupal survey. DAL 2234 has the link to that survey, and that contains the medical equipment waiver request form. It's a fillable form, and I have screenshots of it later in the presentations for you to see. I'm sure you all have seen them, but it's a fillable form that still requires you to attach documents such as the 4235B form and other documentation. So as a side note, non-medical equipment waivers are still submitted through the regional office. It's only the medical equipment waivers that are submitted through the Drupal survey now. One of the things that the Department of Health has brought up as an impediment to getting your waiver requests approved in a timely manner is selecting the type of waiver. So this is a screenshot of the Drupal survey fillable form that you will be submitting, the top portion of that form. And I've circled here where you select the type of waiver. And so it's important to keep in mind that you need to select as many of these choices as you need. So if you are looking to have a hospital bed with an enabling device or a hospital bed with a trapeze, you need to select both of those. You don't just select one. Oftentimes the Department of Health is seeing providers only selecting one when they're actually looking for two pieces of equipment, and that can hold up your application. As I mentioned before, there is still documentation that needs to be attached to the fillable form that you're going to fill out. So this is what it looks like. You upload the files here, and I will go through the different types of documentation that is required in a few slides. So you are required to submit the 4235 form, which is the waiver request form. As I mentioned earlier, this is the same form you use for equivalencies, and you are still going to be filling this out for your waiver requests, but attaching it to that Drupal survey. There is a medical equipment waiver checklist. That's the 4235A form that needs to be submitted with your request, I would suggest doing this first, because this checklist is essentially an outline of everything you need to submit with your request. And it is very helpful to make sure you've checked all the boxes of what you need. So I would fill that out first and as you go, and make sure you submit that with your request. There's also a 4235B form. So you need to prove justification and need for the equipment. And you also need to submit the evaluation showing that the resident can safely and independently use the equipment. I will talk about this a little bit later, because this has been a source of confusion, because the Department of Health has been less than clear on this issue, but you need to have both a signed physician order for the equipment, and you also need to have a PT/OT assessment showing that the resident needs and can use the equipment. You only have to submit one of those. So you can submit either the 4235B form, or if ordered by the physician, a PT/OT assessment. The 4235B form is the physician's order. The Department of Health has interchangeably used the term physician order and DOH 4235B, but they mean the same thing. But this has been a source of confusion because the Department of Health just arbitrarily uses either or instead of using one consistent term for the order. You have to also include your policies and procedures with your waiver request. So you need to be showing that you have a policy that requires the facility to renew the 4235B annually, that you're going to maintain it in the resident's file, and that you're going to be routinely assessing and evaluating the patient's need for the equipment as required. It's very important, as I'll talk about later, that your policies and procedures surrounding how you will go about this waiver request process and how you will go about maintaining the resident's equipment is consistent with across the board. Your policies are consistent with the other information you're submitting with the department and what you're actually doing in practice. So you also need to submit a disaster plan roster. This has also been a source of delay for requests, because it's very important to realize you need to include all facility residents on this roster. You're not just submitting a roster that includes the one resident for whom you are making a waiver request. You have to include all facility residents on your disaster plan roster that you attach to your Drupal survey. You also have to specify on that roster which residents require assistance with evacuation. Again, regardless of whether you are applying for a waiver for that individual. The trapeze waiver, there's a daily safety check that you need to submit if applicable, obviously only if you're submitting a request for a trapeze. So another big part of the application that providers are seem to be doing incorrectly that is holding up their requests is selecting the type of waiver. So the Department of Health has made clear that when you submit your 4235, that you select for medical equipment waiver requests that you are submitting a programmatic waiver. It's a small thing, but if you don't do it correctly, that small thing can hold up your entire request, and we do not want that. So make sure if you are submitting a medical equipment waiver, you are selecting that programmatic waiver. So a big problem that providers are having is that they're submitting waivers, but they're not hearing back from the Department of Health. What do you do? So first, as an initial matter, if we are completing our requests properly and checking off all the things we need to check off, hopefully this process will become even more efficient and we won't have to wait too long to hear back from the Department of Health. But if you haven't heard back and it's been a while, do not submit another request. The Department of Health has suggested that you not submit another request, but rather you reach out to your regional office to inquire about your submission. We all know how hard it can be to reach out to the Department of Health and get an answer back. However, that is the advice that the department is giving to providers. Sometimes it can help to have your counsel call and try to get some information on the status of your application. On a side note, with equivalencies, unlike waiver requests, sometimes you never hear back from the Department of Health. But that's not as much of a problem because an equivalency is, again, more of a notification to the department that you are taking advantage of one of their approved equivalencies. Whereas a waiver request, you are asking for permission and you need to get their approval before implementing the medical equipment. But how should you proceed after you've submitted a request or notified the Department of Health about an equivalency, but you haven't heard back yet? So the DOH 4235 form says the operator must have written approval or be following an approved equivalency prior to instituting any alternative to regulatory standards. So what does that mean? You cannot be using the medical equipment until you've received approval from the Department of Health that you can use the equipment. In my opinion, it is different for the equivalencies because the language of the form says you must have written approval or be following an approved equivalency. As long as you are following an approved equivalency and complying with the use of that equivalency as laid out in the index published by the Department of Health, you can go forward with utilizing that equivalency. But with the medical equipment waivers, you need to get approval from the department. So you should not be using the equipment, you should not be installing it until you've received approval from the Department of Health. Later on, I do talk about situations where you have a hospice resident or someone who urgently needs the equipment. So I will go through that because there are things you can do in those circumstances. So another question that providers have is, do I need to apply every year for this medical equipment waiver? And the answer is no. Once you've received approval of your waiver, you do not need to submit a new request annually unless there are changes in the resident's condition or something that would warrant a new waiver. But that doesn't mean you don't have to do anything. It's very important that you complete a new 4235B form every year, which is the physician's order. It's a form where your physician signs, and you keep that in the resident's record. What you don't want is to have the Department of Health come in and survey you and you not have that updated physician's order. You also have to keep the approval that you initially received on file, because you will get cited if you don't have that initial waiver approval from the department. So while you don't have to keep applying for a new one every year, you need to retain that initial approval on file. So another thing, you need to continue to adhere to your policies and procedures, and you need to routinely assess and evaluate the resident's ability to safely and independently use the medical equipment and the resident's need for the equipment. This needs to be done at least annually upon a change in condition and with each new medical evaluation. So most medical evaluations are required to be done every year. However, if you have a resident that goes to the hospital and comes back and you need to do a new medical evaluation, you need to be checking that they can still safely and independently use the equipment and that they still need the equipment. And as I mentioned before, keep the original waiver approval on file. Referrals to the resident's primary care physician need to be made if a change is identified. So it's very important to make sure that this resident still needs the equipment and can use it safely and independently. So as previously mentioned, you must complete the 4235B form, which is the physician's order, every year and maintain it in the resident's record while routinely assessing and evaluating them. You need to make sure that they can independently use the equipment and that they still need it, as I discussed. And you need to keep in mind the different times you need to be assessing this. So this has been a big question that providers have had surrounding the documentation that you need to submit and keep on file. So this is a screenshot of the checklist I mentioned earlier. This is just one section of it, but this is an example of, it tells you what you need to do and what you need to submit. To me, there was an inconsistency in the directions surrounding these assessments that you need to do. So there are two assessments. One is for need, that the resident needs it, the equipment, and the other is to assess for safe and independent use. Now, it says in this checklist up top under proof of justification need that you need to be submitting a copy of a physical therapist or occupational therapist assessment for the specific medical equipment for which the waiver is sought. And then for the evaluation of safe and independent use, it says that initially they can be evaluated by a registered nurse, a physical therapist, or an occupational therapist. So the question is, this is what you have to do initially, but then every year thereafter, when you're evaluating this resident for safe and independent use and for need, does that need evaluation always have to be done by a PT/OT, or can the registered nurse, who's also perhaps doing the evaluation of safe and independent use, also evaluate the resident's need for the equipment? We've posed that question to the Department of Health, and they themselves were unclear of who's required to be doing these assessments annually, and will be getting back to us. So as soon as I have that information, I can forward that along, because it's very important to know you don't want this to get kicked back because you had a registered nurse doing all of these evaluations when they should have been done by a PT/OT. And so, again, the department is unclear on some of their own requirements, and once we get information on that, we can forward that along. So another big issue surrounds prospective residents. So you have someone coming to the facility wanting to move in, and they might need a waiver for medical equipment. What do you do? The Department of Health's position is that there is no waiver-dependent admission requirement. And a waiver being a factor in an admission decision is concerning to the Department of Health. So what they're suggesting is that a facility needs to decide, can you meet your prospective residents' needs on admission, including whether you determine you can submit a successful waiver request or not? So what does that mean? You shouldn't be denying a resident because they may need medical equipment and you might have to apply for a waiver for them. That shouldn't be a factor. But you need to decide, is there something, can I still take care of this resident and meet their needs either way, waiver or not? So that's very important to keep in mind. You don't want the Department of Health finding out that you're denying residents because there may be a need for medical equipment. As I mentioned earlier, however, if there's a resident who urgently needs medical equipment, a resident who's on hospice and requires a hospital bed, for example, you can notify the regional office upon your submission of a waiver request to help expedite the review. In practice, whether or not the department will actually expedite the waiver request is yet to be seen. However, they're saying it's something that you can do. So I would keep that in mind, that that's an option out there for these waiver requests in urgent situations. But it should never be a fallback. You still want to make sure that when you're potentially admitting someone to the facility, whether or not you get the waiver, can you take care of them? Can you meet their needs? So things to keep in mind. These are common mistakes that providers make that can, again, hold up your application. So it's very important that you know these. You have to specify the regulation for which a waiver is being sought. So It's commonly left blank, where you have to fill in the regulation, and that can hold up your application. If you're requesting a waiver for a hospital bed, you need to specify you're seeking a waiver from 48711 I4 A and B, and it's very specific. You may have those regulations, your attorney may have those regulations. The department has published a list of regs that correlate with the medical equipment for which you're seeking a waiver. And so just make sure you put that regulatory site in your waiver request application. Other waiver requests, as I mentioned before, outside of medical equipment waivers should still be submitted through your regional office, not this fillable Drupal survey. So for example, WanderGuard waiver requests, those are still going to be submitted through your regional office, not the survey. As I mentioned earlier, ensure that the information you submit is consistent. That can hold up your application. If the Department of Health sees that you've listed one thing on a policy and procedure you submit, and then another thing on your actual request, that can hold up your application. If an assessment determines that equipment is no longer needed, then you have to properly remove that equipment and promptly. You don't want the department coming in surveying you and then and seeing that you still have that equipment there. Each waiver request, as I mentioned, is resident specific, thus fact specific. This training is broad, and before submitting a waiver request, it is important to consult with your attorney. If anyone has any questions, please feel free to ask them now. Okay, well, thank you everyone. And if you have any questions that you think of later, please feel free to reach out to me. Do not hesitate to call me or email me. Thank you so much for your time.